majority of defects is a very early and crucial abnormality of embryogenesis. Very early range after conception, neuron tube is formed within 14 days and 8 to 10 days required to complete fusion. Any insult in the during this 8 to 10 days causes defect in the neural tube derivatives, and the derivatives presented to us as spina bifida or other various forms. So spina bifida, among the spina bifida, myelomeningocele is the most frequent and severe form. Severe form means it is not compatible with life such as not, but with all surgical preventative measures, providing all surgical cares, the patients are relatively incompatible with normal phenomenon or quality of life leads quite hamper to the patients. How much patients is suffering from this? Globally, the incidence is vary according to region and country to country, but in the developed country, the incidence is relatively lower. Bangladesh have fallen in the relatively higher incidence country. Some important factor contributes to the declining incidence of this, among them maternal nutrition, folate supplementation during and after before the pregnancy, elective terminations, and others also contribute to it. Myelomeningocele, but this data indicate that last 3 years analysis indicates that few are in our hospital, the frequency of these patients presenting every year is generally increasing. So we have to give importance on the causes to find out the epidemiology in order to reduce the incidence, and we have to also provide a surgical management and observe to this to reduce the observability study. This is the objective. So we plan for a study, that was prospective observational study, which was conducted in the Department of our Pediatric Neurosurgery Department during the last 1 year. So we followed a strict procedure to complete this study. After admission, detailed sentinel history, and we ensure standard protocol-wise management for every patient got admitted to our hospitals. Then we evaluate the patients at presentations, and this data was statistically analyzed, and these patients after treatment we followed for several months, several years. This indicates that follow-up does not mean limitless follow-up up to lifelong. But to summarize the results, we take 3 months of the patients after surgery. These results indicates the last 1 year phenomenon of our pediatric neurosurgical unit admitted patients. Total admitted patients 863, among them 12.8% was first time admission for myelomeningocele. These are fresh cases, and these are the subject of our study. Among the participants, most of the patients present to us within 3 days, they are the form of ruptured myelomeningocele. This patient averagely present to us within 3 days of life. And few patients presented to us within 3 months of life. They are the ruptured, unruptured form, myelomeningocele with insect skin. All the patients, every patient, we evaluate a history, antenatal history, and neonatal check-up, folic acid supplementation history. Here, all the mothers are antenatal follow-up, but full antenatal check-up, significant number of mothers when full antenatal check-up. But pre-conception folic acid was introduced very recently. Unplanned pregnancy was found in most of the patients. Unplanned pregnancy, family history was positive in more than 43% patients. Gestational age was not hampered. The gestational age has no relation with this pathology. Birth weight is not hampered for this pathology. But orthopedic deformity present in the more than 81% patients. Associated hydrocephalus present in more than 1%. It may be present at presentation in few patients, but after initial treatment, that is DPR, most of the patients develop hydrocephalus. The motor function deficiency present in most of the patients, and during the 3 months follow-up period, we found some complications. These complications are analyzed. Most of the patients develop hydrocephalus, and we perform ventricular peritoneal surgery to treat it. But after shunt patient, these patients are also suffering from shunt malfunction, shunt infection, such type of complication. Few patients develop paraplegia, only more than 5% patients died, and the cause of the died is ventriculitis. So this incidence of low, they vary according to geography, but all the research it gives importance to reduce the incidence of pregnancy and complications supplementation. Most of the studies follow the association with hydrocephalus for most of the cases, but also more than 90% patients have hydrocephalus. The postoperative complications vary according to
পরিচয় দিতে না করে আমি বাদশা মোল্লা বলার দরকার নেই, শুরুতে যে বললেই তো রোগ আছে, এখন আসতেছে টাইম নষ্ট করে।
যেটুকু লিখছে সব বলেই আসবে,
একমাত্র আপুর ডাকে নামতে পারে, আপুর ডাক দেন তো।
Even providing standard certificate care and suffering of the baby with myelomeningocele persists. So we have to do something to minimize the cause or to decline the incidence. So preconception folic acid supplementation with planned pregnancy is reduced, will help to reduce the pregnancy. So taking message be aware about unplanned pregnancy and start folic acid before planning of pregnancy. Thank you.
Thank you.